Okay, so I actually have my script because I have a lot to say and I want to make sure I get in these key points. So I'm Kacey Ernst. I am professor of epidemiology and I'm chair of Epi and Biostatistics, and I'm also co-director of the Southwest Center on Resilience for Climate Change and Health. So I'm going to talk a little bit about climate change as an accelerant of infectious disease transmission. First, I want to acknowledge this. Yesterday, the Trump administration repealed the 2009 EPA climate endangerment finding. This finding recognized greenhouse gases as a threat to public health. The administration stated this could save about $3,000 on a new car. Yet in the last 5 years alone, NOAA reports 115 climate disasters costing $746 billion and 2,500 lives. That's roughly 450 per person per year. In this context, it is critical that as One Health professionals, we understand and clearly communicate how climate change shapes disease risk. So, climate change is at its core about energy balance. The sun's radiation enters our atmosphere, heating our planet. Like all hot objects, Earth gives off some of that heat as radiation on its own. Some of that radiation passes straight through the atmosphere, however, some is reflected back again by the blanket of greenhouse gases in the atmosphere. That's good. We need warmth to sustain life on Earth, but as greenhouse gases like CO2 and methane increase, they increasingly trap heat. Add deforestation, and we reduce the planet's ability to absorb those gases. What you see here in this chart on the right-hand side, I guess it is the deviation from the 20th century average temperatures. The trajectory is quite clear. We are outside of historical limits. So heat is energy. More heat in the atmosphere means more energy to power extreme weather events. Warmer air holds more moisture, intensifying both droughts and extreme precipitation. What used to be once in a century events are moving closer to once in a decade. So, this is the latest reading from the Mauna Loa Observatory of 428 parts per million. When I started giving this talk in, I think, 2013, we were at around 400. We just crossed 400. So rising global temperatures first directly alter the climate system, leading to physical changes such as sea level rise, melting glaciers, increased atmospheric carbon dioxide. Those then lead to degraded ecosystems, including forests, oceans, and grasslands. And it's in this sort of second order that you have human and animal populations suffering direct weather-related consequences, heat stress, weather-related disasters. In the area that's really important to One Health and zoonotic diseases, ecological shifts and extreme weather events create receptive environments for vector-borne, waterborne, and zoonotic diseases. These are then further exacerbated by fourth-order impacts. The combined pressures on the environment cascade into social and political instability. As resources become scarce, civil unrest can manifest, leading to breakdowns of governance, healthcare systems, and critical disease surveillance programs. This is a bi-directional relationship. Pandemics can also increase climate change threats. As we discussed in the 5th National Climate Assessment, COVID-19 led to a closure of cooling centers for extreme heat and made people less willing to go to shelters during hurricanes. Globally, there is significant overlap in the regions projected to have high climate disaster risk and the potential for viral emergence. The geography of climate vulnerability is increasingly the geography of pandemic risk. Okay, I want to turn now a little bit into my own work, which is really focused on mosquito-borne diseases and other vector-borne diseases. So recently we conducted a scoping review that was examining complex pathways between flooding and mosquito-borne diseases, and it was led by my postdoc, Dr. Jenna Coulson. So what we found was that research indicates that early after flooding, dengue and malaria often actually either remain stable or actually decrease a little bit. But once you get to those longer time frames, several weeks out, a month out, transmission starts to increase. So to explore this question more regionally and in greater depth, Dr. Ellen Santos, who's from Pima County, who's in the audience, paired flooded and non-flooded Mexican municipalities matched on density, elevation, and infrastructure. And what she found was really striking. So the greatest increase in dengue incidence following flooding occurred when the flood was preceded by drought. So these cycling extremes, dry to wet, appear particularly destabilizing. This pattern of cycling extremes, dry and wet, also seemed to hold true for West Nile virus. So Jordan Robinson is working on a thesis to look at how we can develop forecast models that use early entomological and infection indicators to predict seasonal risk of West Nile. Her initial results indicate that every 1 week increase in extreme drought is associated with a 9% increase in human incidence. In 2021, Maricopa County experienced the largest West Nile outbreak in U.S. history, alongside the largest dry to wet monsoon swing on record. Final results are still pending, but this extreme weather event cycling impacts other zoonotic and vector-borne diseases. So what can we do? If we can understand these weather-disease relationships, we can start building early warning systems. But earlier signals come with greater uncertainty. Public health resources are finite. Early warning has to be co-developed with communities and public health agencies to ensure that they actually produce actionable results. A survey conducted by Mona Aurora as part of her dissertation indicates that public health professionals are really interested in local scales and shorter time scales for the predictions that they find most useful. We've talked a lot about community-based participatory surveillance systems here. I had the pleasure of working with the Ending Pandemics team to develop one for Zika during that public health emergency. And one of the things that I always wanted to do was to merge early warning information into this system. So Dr. Andy Monahan, who I had worked with before, was hoping that we could actually take this 1 month ahead of time abundance model and actually give people a heads up as to when mosquitoes were going to be increasing, empowering them with knowledge and facilitating early confirmation of increasing mosquito abundance from the community. Finally, I just want to switch gears a little bit and discuss another key adaptation principle that we need to adhere to, taking a One Health and systems approach to adaptation planning for critical climate change challenges such as extreme heat, which we all know we are facing really significantly here in Arizona, and it has a significant toll both on humans, animals, and plants. So in Maricopa County, you have a great range of landscape patterns, from native desert environment to increasing areas with lusher green, HOAs that require lawns, and higher levels of shade cover. So shade is really good, great even for reducing heat-related events, as well as for reducing urban heat island effects. That tree planting has become a key strategy to reducing these urban heat exposures. But a systems level One Health approach is really critical. Our research identified that higher shade cover also means greater abundance of Aedes aegypti mosquitoes, as well as a longer season. In a follow-up study led by my colleague in Hermosillo, Mexico, Dr. Marcela Montalvo Corral, she selected sites with higher and lower NDVI within the Hermosillo urban cityscape, and she found a very similar pattern with higher female Aedes aegypti density in areas with greater vegetation. This does not mean we plant fewer trees. It means that adaptation requires One Health systems thinking and planning for those unintended consequences. So I'll leave you with a few takeaways. First, climate change will reshape infectious disease through both gradual shifts and extreme events. Next, we can leverage weather and disease relationships to predict and prepare. Third, adaptation strategies must evaluate unintended infectious disease trade-offs. And finally, reducing health inequities today strengthens our resilience for tomorrow. Climate change is not just altering our environment, it's reshaping the conditions in which pathogens emerge and spread. Thank you.